I'm Dr. Casey. In my Thriving Survivors Chemotherapy Support Program, my goal is to help you decrease your side effects, heal faster, and improve the overall efficacy of your treatment regimen. Today, I want to talk to you about mouth sores. Mouth sores are terrible. They're painful. They make it hard to eat, hard to get the nutrition that you need, and they make the whole chemotherapy experience really, really problematic, even worse than it would have been otherwise. So, how can we prevent it? Well, here's a couple of things that you can try to see if you can feel a little bit better and prevent some mouth sores. So, first of all, ask your doctor about whether your chemo drugs are problematic for causing mouth sores. Taxotere and adriamycin or doxorubicin are two of the more classic ones, but there are more than just those two. So one of the really easy things that you can do is just to keep things cold. And the reason that you do that is while you're actually receiving the chemotherapy, if you can shut down your blood vessels that go to the area that gets those sores, then you're just going to get less chemo to your mouth. And so one of the easy things to do is just to suck on ice all the way through that hour and a little bit further even past the time that you are receiving that IV of your chemo. I also really love when you can suck on spoonfuls actually of like a frozen smoothie. And I have a berry smoothie recipe that you can look up as well. Feel free to go over to my website to take a look for that. And I like the smoothie because it doesn't just get your mouth, but you're swallowing it throughout that hour. So you are also supporting the throat and your esophagus. You're keeping those cold too. And I want you to remember that your mouth and your esophagus and your stomach and your intestines, all the way through that whole tube, that's all connected and it's all that same mucous membrane. And so anything that's going to make your mouth break out in a mouth sore may also affect your throat, your esophagus, your stomach, and all the way through. So we like to keep that in mind. And for that reason, I like to really decrease or eliminate anything that's going to cause any irritation to your mouth or your gut. So one of the biggest offenders for that are acidic foods. And I really like to have you just completely avoid those acidic foods during chemotherapy. And it doesn't have to be through your whole treatment cycle. So depending on whether you have chemo 2 weeks apart, 3 weeks apart, it's usually just those first 3 days or so that are really the most problematic. So things like lemon and citrus and tomato, anything with a lot of acid in it can really kick up those sores, give you heartburn, any sort of irritation through here, stomach issues. And so I really like you to just keep those out. And hopefully when you do those things, you're going to really make a big jump towards keeping your mouth and your stomach feeling a lot better during your chemo regimen. If you have more questions, feel free to come over to Thriving Survivors and thrivingsurvivors.com, and you can contact me, you can set up a discovery call, and you can take a look at the programs as well.